My name is Jason White. I work for the Mid-America Regional Council. It's a council of local governments around Kansas City. I work on ambulance and EMS related projects. One of the topics bouncing around EMS today is how we deal with medical errors. We're all proud of what we do when we've been in the field providing patient care. We all do it to the best of our ability, but the reality is we're all human beings, and human beings make errors. In the emergency medical services arena, we're probably got a few more errors than other environments because we're often working in areas where we've got environmental stresses of family and difficult work environments and difficult lighting and time issues and the compression of our fellow peers encouraging us in critical patients to move aggressively and rapidly, and limited assistance in many occasions. So the environment is certainly more prone, and while EMS has been highly successful, we have to acknowledge we have medical errors. How do we learn from those errors? Well, currently, most services, when they are aware of medical errors, don't necessarily share that information. So you don't have the ability to gather data on a broad perspective and from data learn how those errors come about and learn how to prevent them in the next generation. It's called adverse event reporting. On the hospital side of the equation, back in 1999, there was a federal study through the Institute of Medicine called To Err is Human. You can still check it out on the internet. And it indicated that healthcare kills 44,000 to 98,000 people a year from medical errors, wrong drug dosage, surgical errors. A result of that is federal legislation in 2003 that promotes the creation of patient safety organizations, which are typically little think tanks that gather data of medical errors from hospitals and ambulatory care centers. Early stages of evolution in the United States, and EMS is not a recognized component part of their organizations. There's some activities going on in Missouri, Minnesota, a little bit in North Carolina, recognition of the topic in Rhode Island, but little going on in how do we create a system to elicit adverse medical events in ambulance services on a state or regional or national basis, so we can compile that data and learn from it, and so the next generation of paramedics can do an even better job. Here in Kansas, there are some neat things going on. Sedgwick County EMS has been doing some internal adverse event analysis, and that's led them to some changes in practice that is really extremely progressive. There's conversations with the Kansas Healthcare Collaborative, which seems to be the precursor to the PSO, Patient Safety Organization, here in Kansas. And it's jointly owned by the Kansas Hospital Association and the Kansas Medical Society. EMS needs to be at the table as that organization formulates plans and policies and grant requests for the future. So essentially, the purpose of this conversation is add to your vocabulary the term adverse event reporting, add to your thought process medical errors in emergency medical services. How do we recognize they occur? How do we gather data on their occurrence? How do we learn from those mistakes so we make the next generation of paramedics better?